Welcome to our Global Dimensions presentation on dengue. So to start off, what is dengue? Dengue is a mosquito-borne viral disease transmitted by female mosquitoes, mostly by the species Aedes aegypti, and to a lesser degree, A. albopictus. The virus is transmitted by feeding on blood of the infected person, beginning with replicating in the gut of the mosquito and spreading to the salivary glands, where it can then be inoculated to another person during feeding. It takes about 8 to 12 days for the virus to reach new hosts after being ingested by a mosquito when the climate temperature is between 25 to 28 degrees Celsius. And this period is called the extrinsic incubation period. And once a mosquito is infectious, it is capable of transmitting the virus for the rest of its life. Once the virus is delivered through skin from a mosquito to humans, the virus replicates in the skin's epithelium and is then carried to the lymph nodes by these infected cells, resulting in viremia. This is followed by systemic infection of the lungs, spleen, and liver. The dengue virus is a single-stranded RNA virus with 4 serotypes named DEN1, DEN2, DEN3, and DEN4, which are classified based on immunological and biological factors. These 4 serotypes are considered separate viruses due to being antigenetically and phylogenetically distinct from each other and are related to the family Laphiviridae, which contains about 70 viruses. The mature virion includes 3 structural proteins, envelope, core, and membrane associated, and 7 non-structural proteins. Now on to signs, symptoms, diagnosis, and treatment. For those who get sick with dengue, the symptoms could be mild or severe. The milder symptoms of dengue overlaps with other illnesses, hence it can often be confused for other illnesses that cause fever, nausea, aches, and rashes. Symptoms usually last about 2 to 7 days, and most people recover within a week. Severe dengue, on the other hand, is considered to be a medical emergency. About 1 in 20 people who get sick with dengue will develop severe dengue. Warning signs for severe dengue usually begins in the 24 to 48 hours after the fever has gone away. If a person develops any of these following symptoms, immediately go to a local clinic or the emergency room: stomach pain, tenderness, vomiting at least 3 times in the 24 hours, bleeding from nose or gums, blood in the stool, feeling tired, restless, or irritable. Severe dengue requires immediate medical attention or hospitalization. A blood test is the only way to find out if you have dengue. You should see your healthcare provider if you experience the symptoms listed above and live in or have traveled to a place with a high risk of acquiring dengue. Your healthcare provider can then order blood tests to look for dengue. There is no specific treatment for dengue. Plenty of fluids is recommended to help avoid dehydration from vomiting and high fever. While Tylenol and other medications can alleviate pain and reduce fever, however, painkillers that can increase bleeding complications, such as aspirin, ibuprofen, should be avoided. So what are we doing about dengue? In 2012, dengue fever was marked as one of the most important viral-borne diseases coming from mosquitoes in the world. To combat the severity of this viral infection that they can have globally, the World Health Organization has implemented a strategy for dengue prevention and control, and their goals consist of reducing the mortality rate of this virus by 50% by 2020, reduce the morbidity by 25% by 2020, and to estimate the true burden of the disease by 2015. As 2020 has just arrived, we will probably see the results for mortality and morbidity very shortly, but the results for the 2015 true burden of the disease show an increase in cases reported. From 2010 to 2015, the case numbers reported an increase from 2.2 million to 3.2 million. In regards to prevention and control, the first dengue vaccine was developed and licensed in 2015. It has been approved in 20 countries. The vaccination is more effective on individuals who have had a past infection of dengue. Initially, it carries an increased risk of severe dengue for those who are infected after vaccination. Moreover, it seems that there still needs to be some improvements made if a situation like this can occur, but we have made developments in recent years. Aside from vaccination, other prevention and control methods consist of various aspects. Firstly, prevent the breeding of mosquito population. This can be done so by disposing solid waste properly and prevent mosquitoes from accessing environments they can lay eggs in. This can also be prevented by protecting water use storage containers on a weekly basis, which can be done by applying the appropriate insecticides and covering water properly. Personal protection, such as protecting one's home to keep mosquitoes out and wearing long-sleeve clothing, can also prevent mosquitoes from entering homes and preventing mosquito bites. Educating the community as well as protecting oneself with the proper insecticides can also be beneficial. By implementing these methods, you can prevent and control the viral infection. So why does dengue persist? The primary vector, the Aedes aegypti mosquito, is widely spread across Africa and Asia and has spread globally with increased trade and travel in the last 50 years. In addition to this vector, a secondary vector, the Aedes albopictus, has increased in globalization of trade of tires from used vehicles has expanded as well, which is thought to explain the dispersal of eggs of the vectors, bringing them into new areas. Also, the emphasis for mosquito control in the last 25 years has been on spraying insecticides where dengue is endemic to kill adult mosquito, but this has not been very effective. Climate change may also be a contributing factor to the spread of dengue. Since rainy, humid, warmer climates are preferred for mosquitoes to breed, global warming has caused the mosquito breeding season to lengthen in recent years as well as expanded the areas where mosquitoes can breed. In addition to this, there is evidence of vertical transmission from a pregnant mother to her baby. However, these rates of this are very low. Therefore, global trade, travel between countries, urban crowding, global warming, and ineffective vector control are all reasons why dengue is still persisting all over the world. So what is the global impact, social and economic impact? So the global impact of dengue is that until 1960, Southeast Asia and the coast of South America were the two regions that were mostly affected by dengue. However, now it affects more than 100 countries and has spread to more regions: Americas, Caribbean, Africa, Europe, Middle East, Asia, and Oceania. Sporadic outbreaks have occurred in Florida, Hawaii, Texas, and along the border of Mexico, and these outbreaks were transmitted locally. Additionally, dengue is also endemic in tropic and subtropic regions and is the leading cause of illness among people who travel from Latin America, the Caribbean, and Southeast Asia. The social impact of dengue is that primary care gets disrupted for patients due to the large epidemics of dengue, and most of these epidemics can occur in low and middle income countries. Since there are large epidemics occurring, the number of patients increases, and this makes the healthcare facilities not having enough space and beds to take care of the patients. Furthermore, case findings and follow-up became difficult, and people were having anxiety and fear of contracting the disease. Additionally, the lack of surveillance for the disease and the ongoing growth of urban areas make this disease difficult to combat and prevent in these countries, mostly the tropical regions. The economic impact of dengue is that countries that are mostly affected do not have a strong financial support to keep up with healthcare facilities and to get proper medical equipment. The total annual cost for dengue and control program vaccines and antiviral drug developments between 2002 and 2010 was $46.45 million. In 2010, the annual cost increased to $2.1 billion, and 60% of these costs come from indirect costs affecting households, government, and employers. And in addition, the costs for medication and transportations were unaffordable for people with low income. Anyways, so that concludes our presentation. Thank you for listening.